Changes in prescription drug prices can have serious implications in any state, and right now a new study is revealing the possible negative impacts of government-mandated drug pricing policies could have on North Dakota. Christina Randall explains why these policies would have a negative domino effect, not just here, but for across the country.
The federal government is proposing to expand government-mandated drug pricing policies nationwide. According to one study by the company Vital Transformation, serious consequences around the development of and investment in new medicines could potentially cause significant job losses.
Right now, obviously, we have Medicare, Medicaid, Medicare Advantage. People turn 65 or 67, depending on which retirement plan they're on. And then you have a $2,000 cap for Medicare Part D. And then you basically, once you pay the $2,000, you no more out of pocket anymore in Medicare, at least according to the Inflation Reduction Act. So essentially what we have is we've put in a system under 2003, 2004, the prescription drug benefit law that was passed in the U.S. Congress during the Bush administration.
One of the major reasons the prescription drug benefit law was passed in 2004 was for U.S. competitiveness.
And the reason why we did this was we wanted to create incentives for the U.S. biopharma ecosystem, particularly around personalized medicine, advanced cancer treatments, the way harnessing the era of the genome. We no longer see cancer as one cancer. There will be numerous types of cancers. There's numerous breast cancers. You have HER2 positive, you have triple negative breast cancer. You have all types of cancers. And what we find now is there are very, very effective therapies.
Schultes says that we now have extremely effective gene therapies that help people battling cancer, all thanks to the prescription drug benefit law.
I think in many ways we're a victim of our own success, and we're rolling back a lot of these provisions.
So what is the federal government planning to do now, almost 20 years after the Bush administration law? According to Schultes, proposed federal government-mandated drug pricing policies in the executive branch budget and Senate Smart Prices Act could do more harm than good. He breaks it down a little bit, especially when it comes to intellectual property law.
What this is a bill that creates a generic drug when there isn't necessarily one according to the intellectual property law.
So rather than Congress dealing with the intellectual property law, there would be government-mandated drug pricing. The study shows this act could cause a loss in therapies, innovation, and ultimately job loss. What would this look like in North Dakota? According to the study, we could see a loss of 50 to 78 direct biopharmaceutical industry jobs and a total loss of as many as 225 biopharma supported jobs in North Dakota. For KX News, I'm Christina Randall.
In August of last year, President Biden signed into law what was known as the Inflation Reduction Act, which includes a broad package of health and prescription drug costs. According to the Biden administration, the new law will lower prescription drug costs for people with Medicare and reduce drug spending by the federal government, ultimately in hopes of saving people and the government money.